I appreciate the opportunity to chat with all of you today, and really I'm going to be providing a brief introduction to what our intake unit's purpose is, which I know isn't necessarily new information for a lot of you, but really want to help to answer some questions that you might have, and help to look at ways that we can bridge communication and really be there for all of you as potential reporters to our intake unit. We very much appreciate the work that all of you do for children and families, and excited to be talking with you all today. And if you could go on to the next slide, thank you so much. So our intake unit, just to give you a little bit of background information, we receive and triage the report statewide, and not only for suspected abuse or neglect, but we also, after hours and on weekends, receive calls regarding adults that are in need of potential assistance, abuse or neglect or exploitation to adults. In addition to that, we provide consent to treat for children in foster care and for adults that are in guardianship of the state of Maine, and handle a lot of the question and consult calls that come in, sometimes not necessarily intended for our unit, but we're 24/7, so we do handle those calls, and we're there all the time and happy to help. A lot of you mostly would be wanting to know most of our information relating to prenatal and postpartum concerns that are reported. So we take those reports about families that might be having some struggles with substance use or other risk factors prenatally or postpartum, in addition to the substance exposed infant notifications, which are required by law when there has been substance use during pregnancy that is believed to have affected the infant. So those reports are occurring in conjunction with the plan of safe care that hospital staff, some of you might be familiar with that, are creating, and really working collectively with our Office of Child and Family Services to create a network of support for the infant and the family. Thank you so much. So as I mentioned, we have caseworkers available 24 hours a day, 7 days a week, weekends and holidays, and you can make reports confidentially. General public can make reports anonymously as well, but as a mandated reporter, you must provide your name. Can certainly ask that it be kept confidential. And we understand that there's absolutely, times when you might be concerned about your own safety or the safety of somebody involved in the family when making a report. So it's super helpful to provide that information to us, and we can document that in the report whenever there are those considerations as well. So again, some of this isn't new information, but just wanted to make sure that you had this. We have our 24-hour hotline, which is the 800 number there on the screen. There's also a 626 phone number, which is the same thing as our 800 number and would get you to us. People can also report in person in our central or district offices throughout the state. There's not as much of that going on right now because of COVID, but we do have staff available every day in the offices to take those reports, because sometimes people prefer to report in person. There's also the Maine Relay 711 option for those that might be hard of hearing, and medical, hospital, and law enforcement staff, in addition to school staff with recent law changes, can report electronically to us. And until very soon, we haven't had an option, a good option, I guess, to be able to report electronically. So we're super excited that with a new computer system that's going to be starting in about a week, we're going to have a mandated reporter portal that you all can use to make reports, and it's going to, I hope, help with some of the delays and call reporting time. We understand sometimes we have quite a wait, and we hope that this will be a great option for people wanting to report. So that's only for those specific mandated reporters. Not anybody in the general public can use that. It's a specific piece of the law that allows for electronic reports by those mandated reporters. And we have a fax number as well. If there's additional information, or if electronically somebody wanted to fax us information, we can accept that. All right, so when we're looking at what information is needed to file a report, certainly having the name and contact information for a reporter is essential. The best way to get in touch with you And then any names and demographic information that you have for family members. We understand that you might not always know, the names of everybody that lives in the household or the names of all children. You might not have information about, if it's a prenatal family that you're working with, you might not know the name of the dad. But any information that you have is extremely helpful, and we have ways to try and look and see if we might have in our database existing information. And so that's a real big piece of what we're looking for is anything that you have on that, in addition to a description of what you're concerned about. So if it's prenatal concerns, if there's substance use prenatally that you're worried about, if it's a family that has had involvement with the department in the past, or maybe you've heard some vague information that they don't have, children in their custody, but you're not clear whether or not it's related to department involvement or something else. I saw that comment about background noise. I'm not sure if that's coming on my end. Or hopefully it's okay.
A little bit. But I would just keep going. I think you're managing it very, very well, Kate.
Okay.
Yeah.
Sorry about that.
Okay.
So depending on the type and context of the report that you're making, intake staff will have additional questions to elicit as much information as possible about the family that you might know. So if, for example, if it's a truancy report, we have specific questions that we're going to ask about truancy. And if it's a substance exposed infant report, there's going to be specific questions that we're going to ask about the infant and about the mother's prenatal care, and what substances were used during the pregnancy, both illicit or legal or prescribed medications, and really trying to gather as good of a picture as we can about what might be going on for the family. Go to the next slide. Thank you. And often people have questions about, what happens to reports filed with child protective intake. We really try to demystify the process as much as possible and to help folks to understand that our biggest role is to help, that really what we want to do is, make sure that kids are safe and that families have the supports and services that they need. And then our main goal and what we want to do is really to support children and families. In doing that, when we take the reports, we document them into our child welfare database, and we utilize a structured decision-making tool for each and every call that we take to help us to know whether or not allegations exist, and if they do exist, how quickly the department should respond to the concerns. If it's a report that's screened in for investigation, then the department would respond within 72 or 24 hours. And if it's a report that's screened out, that means there's typically not a role or anything further that the department would do with the report at that time, but it does stay on record and is something that we can refer back to. That's something that is frequently very helpful when we have prenatal reports and we subsequently get a follow-up substance exposed infant report or a postpartum report. There's often things that prenatal providers know that hospital staff might not be aware of when they're making the report. It might be certain specific substance use or other pieces of information that just aren't known by other providers, and so it's still helpful even if it's information that's screened out. Any reports with allegations, as I mentioned, are forwarded to the district office for follow-up. Thank you so much. We might have skipped one. So I think I've already gone over that though. Yeah. Okay, so intake explores whether prenatally the family has, what supports and services do they have. So some of the questions that we're going to ask when you make a prenatal report are, what's going on currently for the family. What do they have for services? Are they willing to work with public health nursing or Maine families? What kind of supports are they willing to have if they don't? And we're willing to make those referrals as long as the family's aware that we would be making the referral. Prenatally, we can't become involved with families that don't have any children in the home. Certainly, if there are other children living in the home and the report meets criteria, we can screen that report in those situations. With a substance exposed infant notification, we're going to gather, as I mentioned, the information specific to substance use during the pregnancy and really look to see, you know, whether or not the family has what they need. And it's a little tricky with those reports because it's not, there's no specific, you know, check mark to say, okay, you know, if this mom used up until this point in time, or, you know, there's no easy way to know whether or not that report would be screened in. There's really a multitude of factors that we're looking at in the structured decision-making tool, sometimes not even related to the substance use during pregnancy. It might be, you know, some domestic violence concerns, or it might be something else going on that really is the reason why we become involved. Certainly, if there's been illicit use throughout the pregnancy and there's no services, there's no nothing that's helping the situation, then we would likely become involved in those situations. Again, with the goal to try and help and support the family and really to make sure there's that plan of safe care for each infant. And then, you know, postnatally, we know sometimes it might not be a prenatal or an SEI report, but there might be some postnatal concerns that you see when working with families. And we want to hear about those things too, to see what we can do to be a support and help. So I think, you know, when we're considering talking to family members, talking to the patients that you work with about reports, I mean, really what we recommend is being honest and having those conversations. We understand there's some degree of you know, professional judgment that you have to use, and there's no easy way to know, yes, you know, you always want to have this conversation or don't have a conversation in these circumstances. As a general rule, we always think it's best to be transparent and to tell families that you're going to need to make a report or what will happen because of substance use during pregnancy or other concerns that might come up. We also understand, though, that there are some families where it would be you know, the timing is really important to pay attention to, and that it could potentially damage your working relationship with them, or you might be worried, you know, geez, they're not going to come back for care if we have this conversation today. So I think that does have to be weighed in, and we certainly understand that there's no like right immediately you need to talk to them about this. We think it's important that they know, and hopefully can help to develop a trusting relationship. But we understand there are definitely challenges. And so we want to know also what's going well for the family. We want to know what kind of strengths and challenges you're aware of for the family, because it's helpful for us to document that information. As I mentioned, even if it's not a family that we are opening with at the moment that your report is made, we have that information on file, and we can look back and see, oh, you know, this family, this parent did really well with sobriety for a period of time. They were involved in services and have these supports, and that information is really helpful for us to have. And if parents that you talk to want to call us directly, we're happy to field those questions and have conversations. I think sometimes that can help with that piece of, you know, understanding a little bit more about what's going to come, what's going to happen next. And so we're more than happy to take those questions. I think in general, avoiding specific promises about what the outcome will be is helpful, because, you know, sometimes it might be a situation where it's, you know, marijuana use during month 1 of pregnancy, and then once the mom found out she was pregnant, she stops using. And at face value, that might seem like something that we wouldn't become involved with, but you never know if there might be something else going on, maybe with the somebody else living in the home, or maybe that parent has had other children removed in the past. So giving general information about what could happen and how things work are helpful, but avoiding those kind of guarantees just because it's hard to know. I think I've already mentioned about the timing of the discussion. And I also mentioned this too, but just really, want to make sure that people understand that we do really feel like, even if it's not something that's screened in the moment, sometimes people can feel discouraged or feel like, well, I didn't need to make that report if it wasn't screened in. And we really feel the opposite, that anytime you have a concern or a worry about a family and you're not sure, please call us. Please, ask, is this something that I should report? Is it, if it's something that you feel like you want to let us know about, we're always happy to take that information. And we absolutely feel like you hold a piece of the puzzle for a family that can really help us in the future to make better informed decisions about safety. And then some of these things I know I've mentioned already, and I'm just being mindful of the time. I know we have other people to speak today too. Is a family engaging well with providers? That's always very helpful for us to know which providers are involved. Is that family willing to receive a Cradle Me referral or any other referrals for services? And we can help with making some of those referrals right from our intake office. And then, if there are other children that you're aware are not in the care of the parents, it might be because that's the agreement the parents have made, and it's not necessarily because children have been removed from their care. And substance use by, either pregnant moms or other partners that might be living in the home, any use that you've noticed during appointments and how that's impacted behaviors and abilities to safely care for the children. And co-sleeping is another certainly important thing that helps us if in the hospital, if there's a concern about that. I mean, we understand parents are tired and it happens. And certainly in combination with substance use, it's a concern. And in particular, if parents have been educated and it continues to happen, we definitely want to know about that as well. When a report is investigated by the department, I'll just give you a brief overview of what tends to happen. The department investigation caseworkers would also use a structured decision-making tool when they're doing their process of investigating what's going on. And that really helps us to be consistent case to case and with each family to make sure we're looking at things in a consistent manner, regardless of who the caseworker is or who the family is. We would interview the reporter and talk to the involved family and household members and really try to get a good idea about what supports the family has and what's going on. Usually this happens within 35 days, and that's our hope, to be able to close out with families as quickly as possible so they don't have our involvement when they don't need it. But sometimes that is delayed if there are subsequent reports that come in or other interviews that need to happen. And as I mentioned, with the substance exposed infant reports, we're also looking at whether or not the infant has been affected by substances based on the information that we have in the investigation, and whether or not there are any ultimate findings of abuse or neglect. We want to coordinate with the care providers involved and really make sure that that plan of safe care is doing, what's intended to be able to help and support that family. And there's some resources I listed. I know, again, these probably aren't new things for many of you, but there is a mandated reporter training online, which is available. And it's always helpful. I even encourage our intake staff to become, use that. I'm sorry, you can probably hear dogs barking in the background, to go every year and just to brush up on those skills. I think it's helpful information. It's easy to do at your leisure, and great resource. And then, obviously looking at the law, looking at, is this something that should be reported or not? Is there something in particular that you're just not quite sure about? Where does it fall within the law? We really, we look at those frequently ourselves and recommend folks do that as well. And just, kind of remembering, you don't have to, it's not your job to, or you're not your worry. I don't want to say not your job, but you don't have to worry about whether or not it's something we're going to screen in or screen out, or, you're hearing information, but you're not sure if it's true. That's something that we can worry about. If you have a worry and you're just not sure, we want to be there for you and kind of help you to take that worry off your shoulders. So feel free to report that to us. And if you ever have questions about reporting or anything, in terms of how to have a conversation with the family, please feel free to call us anytime and our staff can absolutely help you.